For those of you who are new to the Tech Council, we are a multi-sector collaborative that builds government, business, community collaboration to advance digital inclusion for older adults and adults with disabilities in San Francisco. And launched in 2015, the Tech Council's mission is driven by the core belief that the most effective way to address the complexities of the digital divide in San Francisco and elsewhere is best achieved by collaboration across all sectors. And the Tech Council, best way I always find to describe it is we are the community table around which our member and partner organizations convene to promote opportunities for collaboration and innovation. So the first will be a presentation by Elana Kieffer on an interactive map in New York City for aging. And addressing the needs of both organizations and users within New York City.
Hello, everyone. My name is Elana Kieffer, and I'm actually in New York City. So if you hear police sirens or something like that, just let me know and I'll put my headphones on. It's always very loud on the Upper West Side of Manhattan. So I am happy to meet you and see at least some of you. So I work at the New York Academy of Medicine, located in East Harlem in Manhattan, and we work to advance health equity. And I specifically direct the Center for Healthy Aging, and we work to ensure the health and well-being of current and future aging populations. We focus a lot on New York City as well as New York State, and then we also do work outside, as you can see from me being here tonight. So one of the tools that we developed a number of years ago is called Image NYC, the interactive map of aging. And it is what it sounds like. So it is a open source online interactive map that allows planners, funders, case managers, and many other types of professionals to understand the landscape of older adults in New York City, which includes both the socio-demographic traits of older adults, which we define for this map as 65 plus, with an overlay of the services and resources that are and are not available, so that we can see both where there are services and then where there are gaps. And because of the rich data we have, as you'll see in a moment, there is really kind of no limit to the amount of information that we can learn about related to the current landscape of older adults, as well as the future landscape, because we do have some predictive modeling of how older adults will grow in the coming years. So I'm going to share the map, show you what it looks like, do a demonstration, and you'll be able to see some of the different data that we have. And if there are particular data points that you want me to show, just let me know, and you can do it in the chat or you can unmute yourself, and it'll make more sense once I actually share the map. So let me do that now. And I just want to note, okay, so before I launch, I just want to say that this map was created before my time at the New York Academy of Medicine, and it was created in the aftermath of Hurricane Sandy. You may or may not know that Hurricane Sandy in 2012 really disproportionately affected older adults, which is kind of similar to what's going on right now with COVID. And my predecessors realized, like, there's so much information we don't know about where older adults live and what they need. And so they did a lot of research and reporting and focus groups. And what came from that was realizing that we need an interactive map to learn much more. It's obviously become very relevant with COVID as well. So I will show you now. So this is the map. Again, I'll put the hyperlink in the chat box when I'm done. So right now, automatically, you see a map of New York City. And there are two, I'm just gonna move my Zoom people over here so I can see better. So there are two, as I mentioned, there are two main types of categories that we map: services and resources, and demographics. And you can already see right here that these boxes are blue. So that already tells us something. It gives us right now, as you can see on the bottom, the population of older adults, the population of adults 65 plus. With all of these, the darker the shading, the higher the percentage or the number. So right now you can see that there's one neighborhood in Staten Island that has a higher percentage of older adults than the rest, et cetera. So, and now we want to see, so now let's say very, very basic. I'm trying to help an older, let's say I'm trying to help a client that I have identify senior centers, just so I know where senior centers are. So I click on services and resources, and there's all these different categories here. Senior centers are probably going to be under aging services. So when you see this, you can see all these different types of services. Obviously, the huge caveat is that this is pre-COVID. So much of this is not at the moment relevant, unfortunately, but let's go to senior centers. You can see all the senior centers in New York City pop up. And then if I click on any one of these boxes, it's going to give me information you can see on the right-hand side about the senior center. So this one is on 39th Avenue. I can email the program director and I can go to the website. Very, very basic. Now, let's say I want to see senior centers compared to income level. Let's say I'm going to say, you know what? I'm guessing that older adults that are low income may need the services of senior centers more than older adults that are high income. So now I'm going to go to demographics. Under demographics, there are again a number of categories, and I'm going to guess that it's going to be under socioeconomics as income level. Sometimes I'm right, sometimes I'm wrong. I happen to be right now. So now I want to look over here, and I can see there it's divided by income level. So I'm going to be interested particularly in households of older adults where they're the lowest income. They earn less than $25,000 in a year. So now I can start to see a different picture. I can start to see where there are darker shadings, again, which is a higher percentage of older adults that are low income, and senior centers. And I'm going to wonder, okay, are there senior centers in neighborhoods where there are high levels of low income older adults? From first glance, it tends to seem that it is. But now I want to go more closely in. Now let's say I work specifically in Brooklyn. I'm going to choose the borough. We call them boroughs here. And now we're going to zero in on the borough of Brooklyn. Now I get to see even more information. So now let's say, okay, I'm particularly interested in this neighborhood, which is called Brownsville. It tells me just by hovering over 60% of older adults earn less than $25,000. That's a very high percentage. And look, there are 3 senior centers in there, which is good. And now if I'm looking here, 35% in this neighborhood of Rugby, Remsen Village, there are no senior centers. So a lot of this map, and again, I've been to San Francisco a few times, but I don't know it well. In New York, as you may imagine, as I referenced the Upper West Side and East Harlem, we're very into neighborhoods. That's how we kind of identify ourselves. So this map is divided by neighborhoods, or what are more formally called neighborhood tabulation areas. So if you click on any one of these little boxes, you're going to get information about that specific neighborhood. And you can also look for it. So if anyone can unmute themselves, can you just give me a neighborhood that you know of in New York City that we can look up? Park Slope is in Brooklyn. Park Slope, Gowanus here is like the official term, but very good. So based on what you know on Park Slope, do you think there's a high percentage or low percentage of, well, you can kind of see now. Chances are,
low percentage.
There you go, 21%. Exactly. 21% of older adults earn less than $25,000. I heard someone say the Lower East Side. So now let's go there. I'm going to start typing it in. Anyone want to guess if it's going to be high or low for Lower East Side?
High.
You are correct. 67% of older adults are low income. So now what are some other, what else do you know about the Lower East Side? Let's talk about the racial and ethnic demographics of the Lower East Side.
Europeans.
European. Okay, good. So actually one thing we have languages. So now we're going to go back to demographics. And instead of income, I'm going to look at language, we call it language challenges. A lot of this data comes from the Census Bureau, from census data. And we do have, it's kind of a weird category. I'm going to apologize ahead of time, but the category is speaks Indo-European languages and speaks English less than very well. It's a weird one, but it is telling us that actually only 2% of older adults fit into that category. But I'm just going to tell you, because again, I live here, the Lower East Side now is known for having a high Asian population. But let me have the map prove it to you. So now I'm going to go to racial data, which is under demographics, and we're going to go to race and ethnicity. And I'm going to click on Asian. Almost 40% of the Lower East Side is identifies as Asian. And next door in Chinatown, shocking, I know there's a big Chinatown in San Francisco, 80% of older adults that live in Chinatown identify as Asian. So that again is just kind of one of the many, many, many things that this map can show us. I had talked about projected populations. Everyone knows that, older adults there's going to be more and more of them. And the map actually can show us this as well. I'm going to just reset the map. Under demographics, we have this cool category called 65 plus projections, right here. I want to know the projected population of adults 80 plus in 2030. So this is telling me that in all these neighborhoods, this is going to be the projected population of adults 80 plus in 2030, which is obviously going to be different than what it is now. But again, it just it allows city planners to plan, okay, let's see, we might have 20% of a particular neighborhood is 65 plus today, but it might be 35%, which can make a big difference in terms of services and resources in 10 years. This is overall telling us the projected population change, which is actually much more interesting. So anything that's green means that older adults are projected to increase in a particular neighborhood, and pink means that they're going to decrease. So just by looking at that, where's there going to be the highest increase in 10 years? To me, it actually looks like Staten Island.
Okay.
Right? Because look at all the dark green. Now, if we, click on each of the neighborhoods, we might find a more specific number. But again, for this purpose, we're just doing very basic. I showed you some of these socioeconomic. Health insurance, disability is a really important one, especially I know you guys work with older adults and people with disabilities. This again is specifically focused on older adults and disabilities, but it can still provide a lot of useful information. So for instance, we do a lot of work with the subway system, and we want to make sure that the subway system is accessible because we have some cars in New York City, but most people do not have cars. And so it's extremely important. And in order to get to the subway, one typically needs to walk. But if you have an ambulatory difficulty, that's going to obviously be hard. This is all self-reported data, so it's probably actually even higher. But this is telling me that in Mott Haven, which is in the Bronx, a full 46% of people, older adults, have ambulatory difficulty. So now, if I keep that information in mind, now I want to look at the subways. And I want to see, okay, now what about the ADA accessible subway stations in that same neighborhood? Is it going to be a high number or a low number? So now we're going to go to services and resources, and we're going to, instead of aging services, we're going to scroll down and go to transportation. And you can see here that we have all these different transportation points. The one I'm interested in right now is subway entrances that are ADA accessible. Essentially, the ones that have working elevators, basically working elevators is the main one. So now I'm going to click on this. Suddenly they start to pop up. I'm going to scroll, I'm going to zoom in. Now remember, we were talking about Mott Haven, Port Morris in the Bronx. We said about half of the older population has ambulatory difficulty. Does anyone see an ADA accessible subway stop in that neighborhood?
No.
Is that a problem? A little bit. But look over here in sweet Manhattan, where I live, right? Talk about gentrification. All these subways entrances are ADA accessible. And here, only 22% of older adults have ambulatory difficulty. So right away, if I were working with our subway department called the MTA, this is a perfect example. What does it say? A picture is worth 1,000 words. Here exactly proves, and the Bronx, is generally lower income than Manhattan. This proves the discrepancy between these populations, which is obviously going to have some correlation, will have correlation with race and income as well as ambulatory difficulty. So we talked about socioeconomic. Sorry, let's do diabetes because that has a lot of sociodemographic correlated information. So if I'm looking at rates of diabetes, this is actually specifically hospitalization. Again, you can do some interesting cross-reference with other demographic information to look at sociodemographic traits related to diabetes and education and prevention. We have some information on housing, which I know is also a huge issue in San Francisco, as it is here, public safety related information, and we have voter information. Because this is SF Tech Council, I wanted to also show you some tech information and digital access information that we have. So I mentioned the census. We at the New York Academy of Medicine did a huge push to ensure that older New Yorkers completed the 2020 census for many, many reasons that I will not go into, but I assume you can figure out on your own. And we realized in doing that we actually didn't have digital information on our map, and we needed to find it so that we could help figure out where we needed to focus our efforts for those that did not have digital access and that may not even know that they were allowed to fill out the census, not on a computer. We added information about internet and computers. So let's click on households with no internet subscription. So again, in this day and age, this isn't terrible, but in like Ocean Hill, a quarter of older adults have no internet subscription. Manhattan, the Upper West Side where I live, only 5%. So again, it just kind of gets you thinking about where you would want to focus your efforts and what type of efforts that would be based on the data. The other thing I just wanted to show you was that when we had this map, a lot of people said, oh, this is like fascinating information. I want to be able to compare two different demographic points. I want to know the correlation between people that don't have internet subscription, income level. Let's just say that for fun. So obviously this is color shading, right? So we can't at this moment show two different demographic data points because they'll just muddle into like the color brown or something. It won't work. So we needed to come up with a way of showing 2 points at the same time. So our mapper, our cartographer who works at the City University of New York, came up with this idea. It's what we affectionately call a slider. There's a more official name for it that I always forget. But this slider, it actually is already set to older adults who make less than $25,000. As I move it up, you're going to see there's cross-hatching in neighborhoods. So let's go all the way up. You'll see the numbers changing. Okay, I'm going to stop it at 50%. So right now, any neighborhood that has this kind of gray cross-hatching means that 50% of older adults that live in that neighborhood earn less than $25,000. Now, what's interesting is to see, does that correlate with having internet subscription? So let's pick one of these neighborhoods. So this neighborhood, this is in Brooklyn, East Williamsburg. So we know at least 50% of older adults earn less than $25,000, but only 8% don't have internet. So that's actually, it's telling us something. And now let's go over here. In East Tremont, 24% of adults don't have internet, and at least 50% are very low income. So you can begin to see connections between different data points that can, again, inform a whole myriad of information about older New Yorkers. So that's the basics. The other thing I will just say is that there are different ways of searching. So we knew that this is going to be used by, as I mentioned, social workers, case managers, city planners, and also by legislators and elected officials. So we wanted to make sure that we had city council districts. I can zoom in on District 4, which is going to encompass a couple of different neighborhoods because New York City is very complicated that way. But the point is, you guys live in San Francisco, you don't live in New York. But just so you know, we have worked with multiple cities to adapt this type of map to other locations because the mapping system is there. The data does exist. We may not know where all the data is because we focus on New York City, but we're happy to work with you to try to find it. And we have just found, as other cities adapt it to their needs, whether it's aging related or actually not aging related. We talked with the California county who was interested in having this type of map, but focusing on substance use and looking again at sociodemographics with a focus on substance use and where there are services or not related to alcohol and drugs, addiction and services. So it can really, this is kind of like concept can be adapted for many purposes.
And Elana, do you get many, like, is it usable from a, say, consumer point of view too?
Great question.
Yeah.
It is not intended at this moment for your like average older adult who wants to like look up where they can get a congregate meal on their own. There are plenty of tech savvy older adults that can do this, but this map was not created in this format for the end user in mind. We have thought about ways of making it more user friendly, but at this moment we just have not done that.
Great. And do you have any kind of, you've highlighted some of the users like city planners, legislators, community organizations, any kind of stories that kind of just demonstrate the impact this may have had, whether organizations are looking for funding, or like our foundations asking?
Yeah, good question. Thank you. So one of the foundations that we work with and that actually funded part of this map in New York City, they realize the value so deeply of this map that they require any grantee, any potential grantee, any applicant to show the need of whatever the project is by using a screenshot of this map.
Well, this is very impressive. I know myself and Carla have been talking with you and kind of, you know, we're very interested in pursuing a similar kind of resource here for San Francisco. So we definitely look forward to continuing to talk and learn from your work and ways that we can apply the same kind of resources here, you know, to developing a tool that will be beneficial to many types of users. So thank you.